Hi, I'm Efren Colasso, a doctor of student analytics training. In this time, I'll be presenting a video of manual joint mobilizations of the lumbar region. Manual therapy interventions in chiropractic medicine are effective as complementary intervention to spinal manipulations. Within various manual therapy interventions, manual joint mobilizations are the ones that have the greatest association with spinal manipulations. Manual joint mobilizations are passive movements provided by the clinician with variations of amplitudes and intensities, which are divided in 4 grades. The lower the degree, the less amplitude of mobilization. Athletic trainers can integrate manual joint mobilizations in conjunction with the spinal manipulation in the chiropractic clinical scenario. The main goal of a spinal mobilization is to apply a technique commonly known as a thrust, a passive procedure which involves a high velocity, low amplitude motion over an articulation with the purpose of provide proper position of a bone in the articulation. Joint mobilizations interventions after a spinal mobilization has the purpose of promoting effective arthrokinematic movements of the joint after spinal manipulation, thus increasing synovial fluid production at the joint and reducing soft tissue and muscle tension, resulting in pain reduction and increased range of motion. Literature has studied the therapeutic effects of spinal manipulations in combination with manual joint mobilizations. Bromford and colleagues conducted a study to evaluate the effectiveness of spinal manipulations with joint mobilizations to reduce low back pain and neck pain. Regarding to low back pain, moderate evidence were found. Results demonstrated that application of both techniques are effective to reduce pain when compared to non-steroidal anti-inflammatory drugs, short-term effectiveness pain reduction when compared to placebo and general practitioners' care, and long-term pain reduction when compared to physical therapy. In another study conducted by Rubinstein and colleagues, investigators reported significant short-term effect on pain relief and functional status in comparison with other therapeutic interventions. Although literature has not demonstrated significant results of spinal manipulations combined with manual joint mobilizations when compared with other therapeutic alternatives, it has been demonstrated that they are just as effective as many of the existing therapeutic modalities used to reduce pain, which gives clinicians the opportunity to use these manual therapy techniques in settings with lack of advanced therapeutic modalities. Finally, we will be presenting a series of joint mobilizations directed at the lumbar spine and iliosacral joint, important articulations associated to lumbar spine function. So, without further ado, let's get started. So, the first technique that we're going to do is known as the lumbar forward bending or lumbar forward flexion. And as you can hear about the name, we're going to try to improve the forward bending of the lumbar spine. So, for this technique, we need the patient to be sideline. The thighs, 1/3 of the thighs at the edge of the table with a little bit of hip flexion. So my hands, I'm gonna put one hand to stabilize the spine, while in this case my right hand, we're gonna go to the transfer processes, and the anterior tuberosity of the patient is gonna be over my thigh. So what we're gonna do here is, while I'm pushing with my thigh to increase flexion, then I use my left hand to stabilize, and with my right hand doing a force low to improve that motion of the spine, on the lumbar spine. So we can stay here, maybe do some grade 1s, or I can go farther, grade 4, and then do some mobilizations. So the next mobilization is called the lumbar backward bending. So in this case, we're going to try to improve a little bit of extension on the lumbar spine. So the patient is going to be on the side and a little bit moved to the edge of the table. Hip flexion, knee flexion. And in this case, I'm going to use my left hand or my left arm to stabilize the lumbar spine. And the knees of the patient will go over the anterior part of my hip. So in this case, while I'm pushing forward, or in this case the backwards of the lumbar spine, I'm stabilizing here with my left arm. so that we can do that backward bending. So right here, stabilization, and then a little bit of motion, improving the backward bending. So again, depending on the grades that you want to do, you can do grade 1 in here, or maybe you can go further, grade 4, and then do a little bit of mobilizations. The next technique that we're going to show to you is the lumbar rotation with the finger block. And in this case, we're going to use this technique to improve a little bit of segmental rotation. So what we're going to do in here, we're going to flex or bend both knees, and then we're going to identify the spinous process of the vertebrae that we want to restrict to improve motion. So after you identify the spinal process, you can use your second finger or your first finger or thumb. And then once you do the block, then with my right hand in this case, I'm gonna do that rotation. So when we lock the vertebrae, then we do the movement and we improve that segmental rotation. If you're gonna do, in this case, to the patient's left side, so I put my finger on the side, restrict the spinous process, and then I will do the left rotation. Now moving to the iliosacral articulation, we're first going to do the iliosacral anterior mobilization. So in this case, we're going to try to improve anterior motion of the iliosacral joint. So what we're going to do, in this case, we're going to bend the knee. We're going to stabilize here over the sacrum, kind of a midpoint of the glute. And then while I push down to improve the anterior rotation, then I move up the leg, doing an extension of the hip. So at the same time, we're doing force down, and with my right hand doing the extension of the hip. So in this way, we improve force to the iliosacral joint, doing an anterior motion. Increase the rates of mobilization depending on the goals that you want to have with the patient. The next mobilization is called the iliosacral posterior mobilization. So in this case, we're going to try to improve posterior motion or posterior sliding of the iliosacral articulation. So in this case, the patient is going to be sideline, knees a little bit bent, and we're going to identify the anterior superior iliac spine. In that spot, we're going to put one hand, in this case, it's going to be my left hand. This hand is going to do the motion posterior, while in this case, my right hand, I'm going to go to the lateral side of the thigh, right to the inferior trochanter of the femur, and then with the left hand, I'm going to do the motion posteriorly, and with the right hand, do a little bit of flexion of the hip. While I'm doing that, I'm promoting the posterior mobilization of the iliosacral joints. As you see, I'm using my body, stabilizing well with my left hand, and using my body to do the force. Now we're gonna do the iliosacral out flare motion. So in this case, we're gonna try to improve the out flare motion. This is a typical patient where the iliosacral joint is in flare. It's going to the mid-side. So we're gonna improve that out flare motion. For that, we're gonna use one hand on the low back, and in this case, I'm gonna use my thenar eminence to do a little bit of pushing to the inside. While with my left hand, in this case, we're going to the anterior superior iliac spine. And as I do an out flare motion with my left hand, my right hand is gonna go over the lateral glutes to improve that outward motion. Now we're gonna do the reverse. We're gonna do the iliosacral inflare mobilization. So in this case, this is a patient that probably have a lot of outflare. So now we're gonna do the opposite, improving that inflare mobilization. For that, I'm gonna put my whole hand over the low back, right here, and then have a stabilization. Then I go to the anterior superior iliac spine, and I do that motion, pulling to do the inflare mobilization. That helps to do iliosacral inflare. I go here, I can do grade 4, or I can just do grade 1 and mobilizations.